twofold questions. What does the individual do when, um, after something horrific has happened and they find themselves in a slump? And that's the term I'm going to use because I'm not going to let them diagnose themselves, but
Mhm.
they find themselves in a slump or can't get out of this emotion that's down and they can't come back up emotionally. That's my first question. And my second question is, what does the family do when
Okay.
this impact just hits you? Because Chantel had not only had a new baby at the house, she had other children at the house. She has a mother who was there at the time. Everybody's watching this, you know. She didn't just experience, everybody experienced
Right.
it. So share with us for a moment, what about the individual, and then what about those who are connected to us?
Okay, first of all, I'm glad you said, illness, because it not just a stroke, any major illness can affect you as a trauma almost. And
Mhm.
so, and in some ways they are traumatic, especially with a stroke,
Mhm.
because you actually lose a sense of who you are. Your normal has changed. So therefore, um, you have to address the mental as well as the physical. One thing about it, after a stroke or after a major illness, we usually get immediately hooked up with a physical therapist, but we don't necessarily get referred to a mental health or a mental care professional, which you really need, because one thing about it, know that it's normal, first of all, to experience that, because you have had a situation that has affected you. Um, it does not matter what it is, whether it's, I know we're talking about lupus, the stroke, cancer, whatever that diagnosis is, it now impacts you and it impacts your family. And so it is normal for you to feel some type of way. We'll put it that way. It is normal for you to be angry, to go through what we call the stages of grief, because there may be an actual loss there. So
Mhm.
all of that needs to be worked through, and it's best to be worked through with a mental health professional.
Mhm.
So while I am getting my physical therapy, I also need to be getting my mental health therapy,
Mhm.
and not, you know, expecting that it's just going to get better. I'm just going to feel better. Um, don't expect that I can pray it away. We know that faith, is the substance of things hoped for, the evidence of things not seen, but faith without works is dead. So you have to do the work, not only physically with your physical therapist, but also with your mental health therapist or caregiver. Um, the family. I loved how Chantel talked about how her daughter understood her language of being a glitch. And I remember when my mom, her speech was majorly affected, as well as her hearing. She would talk really loud and the words would be all kind of mixed up. And it was kind of after a while, I understood her though. And I would have to translate as if she was speaking a foreign language. I remember doing that with people. They would come in, they'd be like, "What'd she say?" And then I'd tell them what she said. And for quite a while, for many years, we did that. So it's important that the family be patient. It's important that the family uh, also be supportive. And it's important that the family also seeks their own mental health care if they need it. It's nothing wrong with reaching out to a therapist, because this has affected everybody in some type of way. And if you're angry about it, or you are, as you said, not feeling kind of down about it,
Mhm.
then you need somebody to talk to.
Mhm. 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 I had a client last year who had a stroke, an older person though. She had a stroke, and she was learning how to cope again. Um, but I think she came to me for just learning, just being able to talk about her feelings. But we went through cognitive skills, learning how to
Mhm.
just do certain things all over again and making them easy for her. Because not
Mm-hmm.
only did she have the stroke, but she also had an age barrier as well. She was a senior citizen. And so one of the things that we worked on was cognitive skills and the fine ones. Just get a piece of paper and a pencil and just keep this notepad by you at all times and tell everybody that's what's in your notepad. So when you have a thought that you can't remember, but you want to remember, and you know something about, you thought about this earlier, write it down. Write it down when you think about it. Or when you have something to say and you want, it's later on, you need to talk to somebody later on, write it down. And your family members then will look in your book. And so I did, was able to talk to the family and tell them, check in her book every now and then, because
Mm-hmm.
she may have something she wanted to tell you or something she wanted to say and she doesn't remember it now. So this gives her an opportunity to communicate. So just those fine cognitive skills, just being able to, like you said, interpret and helping to not only them, but it helped her, it really helped her. And just being able to talk about her feelings as well, because there were times that she was angry. There was a displacement, like you said, the feelings were all displaced. And so sometimes she would be angry and really not angry, but sound angry, sound
Mm-hmm.
and it was just and again, I'm not a medical person, so I don't know much about medical, and I thank you know uh, Yolanda for sharing that with us today. But um, I know that she expressed feeling angry sometimes but couldn't understand why she was angry, and so we talked about that and we talked about her medication. So yeah, yeah.
Again, a lot of that is connected to those stages of grief, because you have to understand, I have lost something.
Right,
I have
right.
either lost the way that I
Mhm,
live on an everyday basis. I've
mhm,
lost maybe
mhm,
the way that I move, my mobility. I've lost my
mhm,
speech. There's
mhm.
something that I've lost here.
Lost
And I'm
independence.
angry about it. I'm angry
Yeah,
about it and I'm sad about it, you
yeah,
know?
yeah.
And so helping them to, move through those stages of grief and understand it, as well as, like you said, just helping them with sometimes just simple cognitive things that will help make their life better. But also, I also suggest with a lot of my patients to start, doing crossword puzzles and
Yes,
seeking to
yes.
find.
I
There's
did
all
that
these
as
different
well.
things
Yeah.
that I have them doing to
Hmm.
kind of
To one of the family members to buy her a very simple puzzle to put together, like maybe
mhm.
for a 5-year-old, old, something like that. Something real simple, and then let's work our way up to something a little bit more complex. And I said, every day I want you to put a piece together, nothing stressful, just every day putting something together, but start off with the elementary one. And she was able to do that. So I thought that was really cool. And you know what it did? It also made her have pride in herself. She was
That's right.
developing that self-efficacy back within her own self, even though she's living with something different now. She's
Right.
living a different way.
Yeah,
You
it's an
know,
adjustment to a new
it
normal.
is. Yeah. And I like the fact that you brought up the grief process, that, she experienced this grief. So I thought that was very good. And so I got to use that next time I meet with somebody.
And I would
Like,
just say I was angry. I was really angry. And they did refer me to a psychiatrist. And the psychiatrist came in and said, well, I'm coming in just to check on you because they're telling me that you're really, really angry. I said, well, I just had a stroke at 37. I have a 2-week-old baby at home. I have other kids at home. I said, so don't you think I'd be upset? He said, yes, ma'am, you do. So you will have a right to be upset. Well, I'll come and check on you later. I said, okay, bye. Who wouldn't be upset?
I have a question then,
Uh-huh.
and this is me. And for one, strokes do affect the emotional part of the brain as well.
Yes, they
So
do.
it could be part of that. Part of that can be physiological as well as psychological.
Mhm.
But on that
Yes.
note, when you have someone who is going through the stages of grief and they are at the appropriate stage for the time, like Chantel was, what should a provider or what should a family member do to support them? Because I mean, when you're going through the stages, anger is that first stage before you move
Mm-hmm.
through all those other ones. But I don't want to say to Chantel, don't be angry, because
No,
she has a right to be angry. So
that's
as
right.
someone who is supporting her, what would you suggest that family members do?
I would
And then one more
suggest,
question though, before
uh-huh.
you get, and then in order to help her get over the hump, there's a fine line between uh, support and hands off. So can you help us kind of identify what that line would be, if that makes
Um,
any sense?
yes, ma'am. One of the things that I often, especially talk to family members as well as a lot of my students that I work with as a supervisor, is to move with the resistance. Rather, it's kind of like what you just said, is to help normalize that process for them, rather than saying you shouldn't be angry. Yes, I can understand. I would be angry as well.
Absolutely.
But tell me more about this anger. Allow them to talk through it, process through it, and work through it, and listen, and not shame or judge, but to be an objective ear, to sit there with them in that anger, because it's okay to be angry. But now, what are we going to do with this anger? Are we going to use this anger to motivate us to, move forward? Or are we going to use this anger to stay right here stuck? What do we want to do with it? But that all comes in time. But you first just want to normalize it and allow them to have that emotion for a moment, and support that, because it is okay to be angry. One of the things, though, that I'm sorry, I just kind of keep hearing, and I just want to the audience to kind of be aware, and it's probably mainly because of a lot of my DEI work, diversity, equity, inclusion type of work that I do on the side, is that as people of color, we really need to be persistent and clear when we're at our doctors or emergencies or rooms or whatever, knowing your body, like Charlene was saying. If I know that there is something wrong, I am not going to allow you to turn me away or whatever, or dismiss me. I am going to stay there until I get the answers that I need. Because quite often, as people of color, our illnesses, our concerns about our health are not taken as seriously. And so you have to know that going in, I think, a lot of
Yes,
times.
that's true.
I would agree with that. There's a movement to address the disparity between how we're treated as minorities versus our Caucasian counterparts, because what works for them doesn't necessarily work for us. And because of that fact, you can't treat me like you would treat them, because it's
Right.
not going to be effective. That goes all the way down to medications and resources and life experiences. We don't all experience the same thing. So when you say something to me in a certain way,
Right.
I may not perceive it the way you intended, or I may receive it the way you intended, but you didn't mean to intend for it to sound that way, if that makes sense.
Yeah.
And so I know there's Facebook groups where people are looking for providers that that look like them, so that they can identify with them and be on a playing field where they will be able to dialogue a little bit more effectively when it comes to their care. And if there's something that you would be interested in, I would highly suggest that you check on it with your insurance to see who's in your network in order to get your needs met, because we do have a tendency to be treated differently. And I don't think it's intentional. I just think that sometimes the way they treat you in the way they teach them in medical school, you know, it's structured and it's strict. But then when you go into the real world, they don't include everything else. It's kind of like Black History Month. They only give us a month. So when they're treating them in medical school, they only give us a dot. You know, so we have to make our voices heard,
Right.
and we have to be our own advocate when it comes to health.
Yes.
So
Right.
I'm a strong proponent of being an advocate. But
Well,
make sure if you're gonna empower yourself, make sure it's with the correct knowledge, though.
Right.
Yes.
absolutely, absolutely, absolutely. Because I find that, and you know, and this is not to down anybody. It's just I think it's a common question when a person is heavy. They question whether or not you have diabetes, and you know, my logic is every fat person doesn't have diabetes. You
Right.
know, and
Or high blood pressure.
or high blood pressure. Absolutely. So just because you're fat doesn't mean you have high blood pressure or diabetes. Um, or my diet doesn't always include fried chicken, and you
A
know, it doesn't
watermelon.
always include that. So I'm just saying because I've experienced it over the years that someone implied, you know, well, maybe you have to, you know, do something different with your diet and lay off that fried chicken. And I said, oh no, it wasn't fried. There was something else I didn't eat. It wasn't fried chicken. It was something else, and ribs or something they said. And I was like, well, I don't eat pork like that. So what are you saying? And I asked the question to the doctor. At the time I was like, what are you saying? I don't understand what you're saying. And I didn't go back there after that, but I did say, like, I don't understand what you're saying. First, you asked me about diabetes. I don't have diabetes, and all Black people don't have diabetes because they're
Right.
fat. And I said that. Yes, I did. Uh, so I think you're right that we have to have a voice, and you have to articulate without being angry or crass. You can still articulate, no, that's not what's wrong. I know what's going on. And I have a tendency when I go to the doctor, if something is new, I haven't anything new in a while, but if I do have something that's new, I take notes and I keep notes
Yes.
about myself. You know, I have a thyroid condition that came out of kind of nowhere. They said it was contributed to my having my daughter, but it didn't come until years later, after I got pregnant again. But they said it was initially triggered by her, when I first had her. And nobody said anything. And the doctor who treated me said, they didn't say anything about your excessive weight gain. I said, nope, nothing. You know, I didn't, they said I shouldn't have been that big pregnant. And I was like, nobody said anything because I was small when I got pregnant, and then I just blew up. But I had a history of a weight problem. So before before I lost all the weight, I had a history of a weight problem. So I just thought it was normal that I was eating grits and all the other stuff I was eating, because I was eating a lot, 3 meals a day, which I hadn't been eating at all. You know, so again, I contributed too. I didn't pay attention either at that time, but now I'm on it, and I agree with you. And I just think that these little things that you've mentioned, i.e. the high blood pressure. She mentioned the headaches. So if somebody has headaches who doesn't normally have headaches, that should be a warning sign,
The
correct?
worst headache in your life. It is the worst.
Well, if
It's not
people
a
don't get
normal
headaches,
headache.
any headache would be a bad headache, correct? I mean, I'm just
Yeah.
saying,
Yeah.
because I get
Yeah.
migraines, so I know what to do if it starts to get bad. But if somebody who's never had a migraine before, a bad
All of
headache,
a sudden start having headaches, then
right, something's wrong. Something's
Intolerant.
wrong.
It would be cause for
Yeah.
concern, but then
Yeah.
you would also have to look at contributing factors. And I am by no means a doctor, so I'm not prescribing or suggesting. I'm just
Right.
saying, as a professional, they don't automatically prescribe expensive tests for headaches. They may start with some sort of course of treatment to see if that's happening. If your headaches are new and they're not the worst you've ever had, they may do a CT of the sinus to see if you have a sinus infection. You need to make sure and get your vision checked because eye strain can cause headaches. You also want to make sure that if you're over 50, then they're automatically going to go and do more extensive tests versus someone who's only 21. Stress can cause headaches. So you need to evaluate and see what's going on in your life that may be causing you stress. And then they may start you with medication depending on what they think the contributing factor is. You can also be an advocate for yourself and keep a headache journal. And like Charlene, you learn to identify those triggers and those things. Does my headache happen at the same time every day? Does it happen the same time every week? What am I doing before the headache starts? What am I doing after the headache starts? Does the headache get worse when I go to sleep and wake up in the morning? Now, if you go to sleep and you wake up with a really bad headache, that could be indicative of something going on in your brain, such as intracranial pressure. So those you need to talk to your doctor about for sure. But not everybody knows that. But if you're having headaches, by all means, let your doctor know. Talk to your doctor about it, but don't be surprised if they don't immediately jump on it and do all these tests, because to do a $1,200 or $1,300 test for a migraine that is not going to show up on an imaging anyway would not be a smart decision on the part of the provider.
Right. Okay.
So that's what I'm saying. If you have headaches, yes, they need to be addressed, but they may not be addressed in the way that you think they need to be addressed at that time.
That's a good point. That's a good
Yeah.
point.
But I
Now-
think the most important thing about it is that you don't just dismiss it,
Right.
that you actually go somewhere, your
Right,
doctor,
right,
and
right.
talk to them about what's going on with you. Because that's what I often see with people, is that what I have learned over the years is that pain anywhere is an
It's a bad
indication
sign.
that something is
Something's
wrong.
Right, right.
That is what we learned in nursing school. That's the
So,
golden rule. When somebody tells you're in
so
pain,
if
that means
there's
something's
something
wrong.
going on.
Something's wrong.
You need
Right.
to address it. And the sooner you address it, the
Mhm.
better.
That's right.
Sitting up talking about, oh, it'll go away. Oh, it's just this, it's just that. You study trying to guess a diagnosis for yourself.
Instead of going to take care of
That's
it.
just not the good place to be.
Also, I would say if the headache persists and medication does not help it,
Yes.
that's a
You need
problem.
to- Yeah.
Because I was
Mhm.
taking, because I was given Norco after giving birth, and a Norco wouldn't
Right.
knock the edge off of the headache.
I would agree.
Mhm.
Yeah. You need,
Oh.
but again, that goes back to knowing your body and knowing your response to the medications. It doesn't help for everybody. You need to know what's going on, but you need to be able to express what's going on, because if you just say, I don't know, then it's going to be,
Right.
well, I don't know how to help you because I don't know either.
Yes, because even when you tell them what's going on, sometimes they don't know what to do.
Medicine.
Shirley,
ahead.
there was another thing that Minister Yolanda was talking about, and that was age. And I noticed that in Chantel's case, she, God definitely worked a miracle, but she was also young when this happened. So I don't know
They
if
kept saying
age
that.
has a lot to do with the recovery. And if Minister Yolanda, you had some more information about the age part of it.
I think the age puts us more at risk. And from what I've observed, and the older you are, I think the harder it is to recover, because we've gotten more sedentary maybe, or we don't push ourselves as hard. Chantel laying in the bed for 3 days versus a person in their 80s laying in the bed for 3 days is a vast difference. Her muscle recovery would be better versus somebody who's in their 80s, because if a 80-year-old stayed in the bed for 3 days straight, not get up, not move, they're likely not to recover because of their bone density. That's why we don't let old people stay in beds for long. If you go to a nursing home and they making everybody get up, that's generally the reason they should be getting them up, because when you lay in the bed, it saps your strength.
Wow, I didn't know that.
You have muscle, you know, your muscle wasting. You don't, it's like exercise. You don't use it, you lose it. So she was probably in very good condition to where she could recover, and her muscle memory was good. Now, I'm not a therapist, So again, that's my disclaimer, but I'm just saying, you know, generally the older we get, the more we have a tendency to not keep up our activity level and our exercise. Now, I know some 75-year-olds that will put me, you, a whole lot of people to shame.
I know.
But I sit at a desk sometimes 10, 12, 14 hours a day.
Yes.
That's not good for me. And I know that. So I need to counteract that with exercise because of my bone density in order to maintain healthy bone and in order to maintain healthy muscle. So age is a factor in that. More than likely people who get older don't take care of themselves as they should.
And I think I had to push myself to get better because remember, I had a 2-week ovation.
Yes.
Yeah.
Yes.
Motivation. Yes.
Mhm.
Motivation is the other thing.
Yes.
Yes.
And I would sit in the room literally by myself because I told my family don't come up because I'm telling you, I was angry. I was very angry. And I had to, now my leg still wasn't right. Okay. It was still weak. I was supposed to call for somebody to take me to the bathroom. But of course, you know, being stubborn, I didn't. I said, no, you go do this. We go get up and we go walk. You know, I'm thinking we can wheel it away. Whatever. Okay. So I got up out the bed, made it to the bathroom. On my way back, I hit that floor and I just laid there for a little while because I still remember the coldness of the floor. And it was a wake up call for me. You're going to have to rely on somebody to help you. Because right now, you can't even walk on your own.
That's another thing that I wonder about as women. We're always supposed to be the strong ones.
Mm-hmm.
And we're always supposed to be the caretakers of everyone else. So when it comes to us needing support and help, I notice we struggle with that.
Mm-hmm.
And I
Vulnerability.
wonder, yeah.
Vulnerability. Yeah. Mm-hmm. And I'm going to take a moment real quick. I'm going to take a moment real quick to welcome Letitia and Latanya to the discussion. So,
hello, ladies.
Great conversation.
Hello.
Hello. Great conversation, ladies.
Hello.
would y'all like to introduce yourself real quickly?
My name is Tisha. I'm a cardiac nurse. I've been a nurse for 10 years. I'm with patients who have heart failure, diabetes, stroke, heart transplant. I've seen all types of patients, all types of populations, educating patients, even patients who had open heart surgery and heart attacks. My mom is a 15-year survivor of a heart attack, and so this is a great topic and great way for us to educate and advocate for our counterparts and our culture in the community. So I'm just glad to be here.
Thank you for joining.
My name is Latanya Baez. I am an advocate for lupus. I am a surviving lupus as well. So much of a resume that I have, but to kind of narrow it down, I've been a victim and still is related to heart issues. And I've been in the autoimmune world for at least 30 years. I kind of stopped counting after 20. I'm an author, an entrepreneur, a mom, and just fight for life every day. So thank you for joining. Thank you for allowing me to join you guys. And I'm looking forward to hearing these great conversations.
Thank you for joining.
Awesome. Well, since we've segued into that, let's, Elder Yolanda, I want you to share with us, just kind of give us a definition, if you will, of lupus. What is that, Elder Yolanda?
I think Latanya would probably be the perfect candidate to tell us what it is, because as she said, she's had 30 years in the autoimmune world. I unfortunately am brand new to and I say unfortunate because I have a granddaughter who was newly diagnosed with lupus. And so I understand lupus, and I have it's an autoimmune disease. Nobody knows where it comes from. It just attacks, you know, and it can attack different organs. But I would like to hear from her to see what she has to say about it.
Okay, come on, Latanya.
Well, no problem. You were dead on spot. You were absolutely correct. It's an autoimmune disease where you're good, you know, to kind of bring it down, you know, on our world. It's the good cells fighting the bad cells, you know, so anything you can wake up and have swollen of your arms, joints, muscles. You possibly you probably may not even be able to walk. You have migraine headaches. You're sensitive to light. I think I told my story at one time where it's that I have a crutch, I have crutches, I have a walker, I have a wheelchair, because you never know what your internal body is doing with this autoimmune disease. So you're good and you're bad and they're fighting. And when that happens, when you end by that battle, it's normally every day. You have flare-ups and you just have to manage through it daily.
So tell us, Latanya, when did this start? Like, what happened at the very beginning that let you know or sent you to the doctor, and then the diagnosis came? But what happened on the onset?
So the onset for me was a stroke at 19.
Okay.
I wasn't diagnosed at that time, but that's where it all began. I was 19 years of age. I had one child, had a difficult pregnancy, was trying to work 2 jobs and, you know, manage life. And my body just shut down. I fell out in a bathroom with my baby in the tub. And so, of course, somehow I ended up in the hospital. Long story short, they advised me that was stress. Oh, she had stress. So over the years, I felt like a test dummy. I was doctor after doctor. I ended up doing chemo for years, you know, and finally I was like, you know, enough is enough. But eventually in that time span, from having gouts and AFib and, you know, fluid on the brain and, you know, rheumatoid arthritis, you know, the list goes on, along with, you know, carrying or taking at that time 15 medications. I just kind of drew the line, you know. So today I live healthy and seek a naturopathic doctor in order to continue on. But that was my journey, and it was tough, very, very tough.
Okay. Wow. Wow. Does someone else have a question? I don't want to bombard her with all my
Oh,
questions.
no. I would
Well,
just like
I
to
have a
say,
good friend that has lupus, and she was trying to explain to me about the white blood cells. And from what I'm understanding, it's almost similar to a form of leukemia or maybe even Hodgkin's. So I just didn't understand fully. And so when you say good fighting bad, is that kind of what you're talking about right there with the white blood cells?
Absolutely. Your cells in general, your antibodies, your good and your bad. And we're lupus, I'm claiming it. Lupus is the umbrella, is the head honcho, the running the mama campus. It's over all of that, from gouts, you know, Graves to autoimmunes. Your you know, it's a triangle and domino effect that leads up to lupus. Lupus
Okay.
is it that's done. You know how we categorize up to heart failure or cancer, or it's the top. It's nothing else, no cure, nothing they can do, don't know why kind of situation. So yes, you can fall into leukemia. There's multiple types of lupus. There's SLE, systematic, where it affects your organs, your joints, your bones, and you have DLE, which is discoil. And discoil is just mainly for your skin, you know. So some people fall in that category of vitiligo and all these, you know, fatigue and things of that nature, along with skin lesion because of the sun. So they are placed and categorized and discoiled in DLE. mine and anyone else who is in the world that has kidney failures, you know, like some of the famous our actress, I can't think of her name, a singer that came out, and she, yeah, and yes, and Nick Cannon, theirs are SLE. It affects their organs, their kidneys, their heart, their brain. So yes, leukemia has anything autoimmune related. You wake up, you can stump your toe. And then now your body has to heal what it damaged. And so we don't know which it's gonna go when it's trying to heal himself, because we don't know they don't know if it's good or bad that they're fighting towards.
Right.
So
It's
now,
a chaos.
let me
It
add a
causes.
few things. Oh, I'm sorry, Tony. I'm sorry, Tony.
It
I'll just
causes.
add a few things just so our listeners and everyone can be
Letitia, you're
educated
breaking
and
up.
as they advocate for them. Can you hear me now?
Yes.
Yeah, okay.
Is it still breaking up?
No.
No, it's okay.
Is that better?
Yes,
Yes.
yes, yes.
Okay, so I'll just add a few things so we can educate our audience and they can begin advocating for themselves. The biggest issue with hypertension, lupus, or strokes, it is a blood flow issue. If you could just get in your mind that hypertension, diabetes, a stroke is a blood flow issue. So think about a water pipe. If you have a water hose and the hose is supposed to be letting water out, that is the normal way that it is doing it. But when you have a stroke, you're saying my blood is not pumping properly, or the water is not coming out properly from the pipe. And so when the water is not coming out properly from the pipe, you have to go backwards and figure out what the issue is. Is the issue diabetes? Is the issue my kidneys? Is the issue, but regardless of what the issue is, now my heart and my brain is at risk of being, that's what happens in a stroke. Your brain is not getting the proper amount of blood supplied to it. And so when you guys were talking about living a sedentary life and that age problem and the age and all those things, about a blood flow. It is, when you're talking about hypertension and when you're talking about high cholesterol, it's all about how your blood flows. And so when I was talking to Tanya the other day and we were talking about lupus and she's talking about an autoimmune disease, thinking about how your body attacks itself. Can you imagine how your body attacks itself in the blood that is pumping and that is flowing? So it's like you're trying to help your kids. You're trying to help your kids, but they fighting you. That is an autoimmune disease because we are in the same house and trying to do the same thing and the best for you, but you're trying to go this way and I'm trying to go this way.
You
And so
said
an
it.
autoimmune is a blood flow issue, well, that my body is attacking itself and it's not normal. As a practitioner,
Letitia, you are saying great things, but you're breaking up again. So I just want to tell you.
in our nursing school books,
Can you hear me?
one of the things that they taught is that blacks are more susceptible to pain and we deal with them. That is a stereotype. What makes us deal with pain better just because we're black? And so we have to educate and advocate for our own health. Otherwise, no one else will take us serious. And so when I was talking to Tanya the other,
Oh, we lost her.
Lost her. Well, she'll be back. But I want
Yes.
to say something to LaTanya. You brought up a point when you talked about that umbrella and you said Graves. And I have a thyroid condition that I now have Graves' disease. But I don't normally say Graves' disease because people are like, what's that? You know, but I'm on the other end of my thyroid condition because I've been treated. I've had everything. And so I'm on living now, just living. And so when you said it fell under that, you know, I'm like, wait a minute. Nobody ever told me that before. That and I didn't have Graves' disease. That's what I have now. And they were explaining to me that it was on the other end of my living of my thyroid condition. So you said something else that kind of struck me. I remember after I had the radiation and all the other stuff I had, they said that I have to be careful in terms of cutting myself or, you know, I was young, so I was a little in this, you know, I didn't believe stuff. But I was washing dishes one day. I like to wash in hot water. I don't know why, but I do. And I broke a glass in the water, right? And the glass broke and it wouldn't heal. And so when I went to my thyroid appointment, my endocrine appointment, I was showing her and she said, this is what I'm trying to tell you. You have to be careful because your body doesn't heal like it used to. And I just didn't, of course, at that time, I didn't take it seriously. I take it seriously now. I'm real careful about stuff. And some other things have happened. But that is very interesting when you said that it's under this umbrella. So I guess my next question to the medical professionals, does a person develop that could go up to lupus from these other autoimmune deficiencies? I mean, diseases?
Well, again, they don't know what causes lupus,
Right.
but
Mm.
in the case of my granddaughter, she had eczema as a child, as a little one. Eczema is an autoimmune disease.
Oh, I didn't know
Then,
that.
yeah, it's under that umbrella of an autoimmune disease.
I didn't know that.
Then she had the headaches, and then she had the joint pain, and then we went to a doctor's appointment. Her blood pressure was up. They sent us to the hospital. She was in the hospital for a week. Did a kidney biopsy. All her tests came back for positive. So that's a very good question. Does it start there and go up? They can't even tell what causes it, so it's hard to say. They say it may be hormonal for lupus because it hits women between childbearing age, which Latanya was diagnosed at 19, childbearing age after she had a child. My grandbaby is only 13. So she's just starting the hormonal stage. So again, it hit her early, or she's been diagnosed early, because I'm like, Latanya, we ain't claiming that over her. But she was diagnosed with it early only because the test came back positive. And then once they did the ANA titer, which is what they do for the inflammatory markers, they did the other two tests and they came back positive as well. She's responding amazingly well to all her medications and doing well. But again, nobody knows where it comes from. To me, it's like the COVID. It's a moving target. So I know we can't pray it away, but I'm sure aiming my prayer at that. So it does not take over, because right now she's stable. She's doing well. Her kidneys function is doing well. She's doing her medicines. They're tapering her off her medicines, but it just came out of nowhere. And so that's the thing about lupus and other inflammatory diseases. It's not like diabetes, or where you can say, okay, your hemoglobin A1C is 6.0, so you're definitely in the category range. Lupus is one of those things where they eliminate stuff before they diagnose you, because they can't really say you have it unless they do a scale, and it's like, if you have at least 4 or 5 of these criteria, then you more than likely have it, and then they do the other test, and then it's like, okay, well, we really think you got it, because now we're doing one more test and like, okay, we can safely say this is what you have, because and you can have all the symptoms, but you don't have to have all the symptoms at one time. So you could have the butterfly rash. 6 months later, you may have the joint pain. But you go to your doctor and you complain of the joint pain, and you didn't mention anything about the butterfly rash because it came and it went. So then lupus is not on their radar because you don't have 4 out of the 5 symptoms.
That's interesting.
So it's one of those things, it's a moving target. And then, then we're at a routine checkup. Her blood pressure is up. Do a urine sample. She got protein in the urine. But you're 13. Where is all this coming from? Again, we would have never thought, because that was not on our radar. Hypertension, we have in our family. Lupus, we don't. So you can't even say family history when it comes to her, or let me rephrase that. We don't have it in our family that we're aware of, but because it's a moving target, it could be there and no, it was never identified. So again, to answer your question, I can't say that it does or it does not because it's that umbrella.
If I can add to that, I found out through a couple of researches, there was a China study out there in 2018 that is possibly genetic.
I did
Reason,
see that. Mhm.
yeah, and
I
so
did see that.
when I was researching that, I decided to go back in my history and my family. I'm from the South Side of Chicago, so we don't talk about what goes on in our families and our health or whatever. We just know that Boo Boo passed away and we're going to their funeral, right? So with that being said, there's multiple cirrhosis, there was Sjögren's, there was a lot of things going on, cancer, everything that was going on in one side of my family. And after doing research, all of those played up on the domino effect. I just got the queen and king of it, you know. So in some cases it could be genetic as well.
It could be, yes.
That's funny you say that because I, when I was diagnosed, at the time it was hypothyroidism. Um, again, not understanding what was going on, why I was having these other symptoms. They asked me about the second doctor I saw was an internist. He asked me what was my history and who might have had it, and I probably need to find out. And at the time, my grandmother was still living, and I was talking to her about it, and she was like, "I've never heard of that before. I don't know anybody who had that." But then, about it, maybe 6, 7 months in, I was talking to my cousin who, which is weird, she's my second, third cousin. Her father, my mother were first cousins. So there were two sisters' kids, and we were their children. Okay. She had it, and we're a year apart, which I thought was so weird that, I guess that was a God moment, but she had called me just out of nowhere and just said, I was thinking about you, and just called, and I told her what was going on. And she said, "Oh my God, that's what's happening to me." And she had thyroid cancer. She didn't have, didn't have thyroid disease, but she had thyroid cancer. And when I went back to the doctor and told the doctor, he said, "Well, it's definitely on your mother's side." And he said, probably it was, that people in the country didn't know what it was. And so, they just knew somebody was sick, but didn't know
Right.
what it, and couldn't, because its symptoms are all over the place and you can't pinpoint what symptom you have, just like you said. So, but what I've done going forward is with my daughter, I told her, you need to tell them that I have thyroid disease. You may not have it, but I have it. And my husband, they have diabetes. I said, you need to get checked because you have these strong histories behind you. You don't know what's going to happen because now it's definitely in the bloodline. So we have to be aware. And before you ladies got on, that's one of the things we were talking about is being able to know your body and be able also to tell somebody, tell
Right.
your children, tell your family what you have.
Absolutely.
Not a secret,
Mhm.
Absolutely. And I think, to piggyback off of that, Sister Shirley, I miss you guys so much, is knowing the symptoms of things. And so when you're talking about a stroke, knowing the symptoms, I know you guys seen the FAST sign anywhere, FAST. And so for all our listeners, you could really help save your loved one's life if you just knew the symptoms. So the S is for facial. Do they have a facial droop? Like, ask them to smile. What does it look like when they smile? Or do they have a facial droop? And that is a big sign and symptom to say, you know what, something is not right. This is not this person's normal. And so ask that person to smile. Is it uneven or is it lopsided? You've seen all the memes about, uneven smile. And then the A stands for arm weakness. Just ask them to stretch their arms out. Is one arm weaker or stronger than the other? Does one arm fall down better or holds up better or worse than the other? You want to make sure that arm weakness is not there. And then the other one is speech. Do they have a slurred speech, like you have a slow Zoom connection? If you hear someone that has a slurred speech or unable to speak, the next biggest thing is time. One of the things they teach us in the hospital is time is brain. And so the sooner, within the hour that you could get someone to the hospital and get them perfused, remember, it's a blood flow issue. So the sooner you can get someone to the hospital and help their blood continue to flow, the better they are with their life circumstances. Like you were talking about, Chantel, you had a stroke, you were in the hospital. Those labor and delivery nurses knew what to do because you were there. But time is brain, and you could really help people if you just know the signs and symptoms of a stroke, signs and symptoms of a heart attack. You can really help save your loved one's life or even your own.
You were mentioning something before. You were we kind of lost connection. Do you remember what you were saying before?
I was talking about how it's all a blood flow issue, and we do not want to. So when you have high cholesterol. So what happens with high cholesterol? Your blood is flowing as normal, like a water hose. But with high cholesterol, throw some fat in there, throw some nails in there. With high cholesterol, you are having things that are stopping your blood from flowing profusely or flowing properly. And so it slows down. And so if your blood is slowing down, then it's not getting to your brain as properly. And if it's not getting to blood, it's not getting to your brain, that's when you are at risk for a heart attack or a stroke. If it's not getting to your heart, you're having a risk for a heart attack. If it's not getting to your brain, you have risk for a stroke. And so we want to make sure when your doctor is telling you to take a baby aspirin, it is for your blood flow issue. That's all it's about, the blood flow. And so that'll preach in so many ways, y'all know it. I just see blood flow so many different ways in this thing. But so even when our patients, a lot of my patients, they go for a heart cath. And so they'll say, you know what, I'm having chest pain and I don't know where this chest pain is coming from. So the doctors will take a scope, they will go into their groin or in their wrist, and they are looking to see if you are blocked. How much blockage do you have in your artery? And the reason why that artery blockage is important is because blood can't flow. Again, if blood can't flow, we are at risk for a heart attack and stroke. And so when Sherilyn was talking about the people think that I eat fried chicken and all those things, and that is true. But the reason why fried chicken contributes to a heart attack is because the grease clogs our arteries and preventing blood flow properly. So when my mom had a heart attack 15 years ago, she had a heart attack and she had triple bypass, meaning 3 of her arteries were clogged. They had to go in and put stents in her heart to keep it open so the blood can flow properly. But she was a smoker. She was eating all these different things. So smoking, stress, not eating healthy, all those things clog your blood flow. I don't care if you don't listen to hear anything else. It's about blood flow. That's what I was saying.
Can I ask a question?
Amen.
I have a question. Okay. And because I have Graves' disease, so I already know part of the answer. But I fell, and I know you're not here to diagnose, but I just want to make a point. I fell a few years ago, and I fell up a concrete steps. I was walking up, and I slipped, and I fell on the concrete steps. And as I told you earlier, I scar easy, and it doesn't heal fast. So apparently, when I fell down the concrete steps, it damaged the tendons on my shin, as we call it. The front of your leg is a shin, right? The shin. And I just noticed for years, what'd you say, Letitia?
No, I just say, yep. Mm-hmm.
It's my shin. Okay. So I just noticed over the years that it darkened and it looked like somewhat collapsed. So I'd asked my doctor about it, and she said that I should have went to the doctor when this happened, and I did, because I told you I go to the doctor. So I did go to the doctor when I fell, and the doctor told me, that's how I knew I had damaged the tendons, but he said there was nothing that they could do because it was bruised, and it was damaged tendons. But she said it looked like blood had stopped in that area. That's why it looked so dark. It's in the front of my leg. And it looks different than my other leg because it looks like it's, like I said, collapsed. And she said, my present doctor said, I should have went. She says, probably nothing we can do about it now because it's, you know, it's stable, it's nothing there. And she checked it out and everything. She says, but I think they should have looked at it more, especially knowing that you had Graves' disease. Because I didn't know that I should have done that. I didn't follow through. And so I wanted to say, to ask, you know, any of the three of you, because you all professional in this area, if somebody else has that, has an autoimmune disease, and because I didn't know that either today, that about the umbrella. So if they have an autoimmune disease and they are not healing properly, or they are not, or they find out they've fallen or they hit themselves. You mentioned stub your toe or something like that, because we do little simple things all the time, you know, not thinking, or falling down the stairs, and not paying attention. You know, what should you do? What should you say? What should you do? And that's for any three of y'all, because I don't know.
Okay. My question is, how did they know it was a tendon versus actual blood damage or blood loss in that particular area, and why didn't they treat it differently? My understanding is when we have an injury, white blood cells go to that area to help fight infection, and then we have clotting factors that go to that area to help clot so that it will heal up the wound so that blood doesn't continue to ooze. But if it's underneath the skin, then you have a bruise, so there may be something else going on. And it may be something going on at the time that because you do have thyroid, or because you were diagnosed with Graves' disease, what was your clotting time like? You know, are you taking aspirin? It could have been any number of things that caused bruising underneath the skin. So again, that just goes back to knowing your medications.
I'm sorry.
And what medications are for and why you're taking them. And then knowing your side effects of your medications and how they interact with each other. And then again, knowing your, being knowledgeable about the disease process, and then knowing the pluses and the minuses of the disease process, as well as knowing how your body is responding to the disease process, how your body is responding to the medication, so that when something is abnormal, you know what it is and how to address it. But tendons are in one category and blood disorders are in another category. So I'm not sure what the correlation would have been with that particular situation. Because I know with autoimmune disease, most of the time the pain and swelling is in the joints. So it wouldn't be affected in the shin area because it usually, like I said, affects the joints. It doesn't necessarily affect the tendons. However, because it is so vague, it could affect tendons, in which case you would have inflammation anywhere within your body. So with that being said, that's all I have to say on the topic. It could be Latanya or Letitia might have something else to add, or Chantel, because she unmuted.
Oh no, I don't know anything about that part.
No, I was just asking because of the risk factors that go along with lupus, and we're going to talk about that a little bit more in a minute. But what are your thoughts, Latanya?
So I'll speak. My family has found me home. They went to church and came home, and I was unconscious on the floor, all related to blood flow. As we mentioned earlier, I've bruised multiple times, having surgeries, because I had multiple surgeries. It took a long time to heal. And again, I find that it's related to my blood. It's, you know, my body has to bring everything what it needs, you know, as you know, you mentioned earlier, so that it can heal itself. And so, and I would assume in your circumstance, it just did what it could at that time. I know any bruise that I get, it could take months to heal because internally what it's going through. Aloe vera is my friend. I have multiple aloe vera plants because I can get a pimple that can lead to a huge bruise on my face, a simple, small little pimple. And if I don't treat it right, it could turn into a black eye. So internally, it depends for me where things go. So I also have to be very, very careful when it comes to bruising and surgeries and trying to recover. My healing process is, very, very, very long and difficult. Just to give you an example, I just recently had a surgery and they had to require for me to go under, and I had to be hospitalized because I couldn't wake up. So, and they couldn't figure out why. At first it's just the anesthesia, oh, maybe it was just too much or something of that case. But even after that went down, my body was still taking its time to heal, to get wherever it needed to be for me to be where they needed to release me. So it's a healing process, I want to say, on my end.
Okay. Okay.
Absolutely. And like everybody has already said, Shirley, to answer your question, it's a blood flow issue. The question is the blood flow did it just leave a bruise, or is it accumulating there as something as evident as something else? And so it really is all predicated on how well or how fast or how slow your blood clots. And so maybe for you it was just a bruise, but we don't know these things. That's why a lot of patients and people in our culture die from blood clots, because we don't know what our clotting looks like. We don't know what our blood factors are. It's like, I clot slow, I clot faster. So we need to know things about our health so we can advocate for it. So if I have a bruise, I need to make sure that my blood is not stagnant in that area, which again is a blood flow issue, and it can lead to a heart attack or a stroke. And so you just want to make sure, again, you know those symptoms and you know how your blood flows.
That's a good answer. So listen, let me ask you this. So what are some of the risk factors that we need to look at lupus? We've talked about some of the risk factors for the stroke. What are some of the risk factors for lupus that if somebody is watching now, tell us what are some of the risk factors with that?
I think Tanya is the expert in that. I'm going to do a little plug for her. She got this amazing book called Lupus, It Chose Me. Get the book, and she'll have some of those symptoms in there. But Tanya, yes, educators on that.
Can you put it up a little closer, LaTanya, once again, so our readers can see it? Lupus, It Chose Me. Excellent, excellent, awesome. And so we want people to be able to see that, and we're going to make that plug again before you leave, because we want people to be informed, okay? I mean, people don't know, okay? And I think when you brought that topic up about the umbrella, I don't think people knew that. I know I didn't know.
I didn't either.
Yeah,
either.
like
Yeah.
I just opened my
And
eyes.
like you,
So-
Charlene, I've been diagnosed with hypothyroidism. After I had my son, about 5 months later, I was diagnosed with Hodgkin's lymphoma, stage 3B. Went through all the chemo, radiation, all that stuff, and I've been healed since 98. Yet I did not know. I knew that I had an autoimmune thing going on because I had to be quarantined and all this different stuff. But I did not know that it could fall up under that umbrella of lupus. I had no idea till today.
Yeah, that's
Very
just
interesting.
very interesting. And so we want people to be informed about that. So we want you to also post your book again at the end before we leave, because I really think that we as a people, and you know, I'll try to stay in the middle when we have these conversations. I do, but you know, I think we have a lack of knowledge a lot of time because we don't know.
Right.
And we don't talk to us. We don't talk amongst ourselves.
Right.
You know, we find out that somebody has something because something else has happened.
Right.
So we have these platforms and people get on, they're able to share with their family members what they've heard and, you know, what is out there. And it doesn't just stop here. We may be on Facebook Live now, but our platform goes to also to YouTube. So people can come back and look at it later and see this discussion. So I really, really want people to be informed. And so before we leave again, just to reiterate, I want you to post your book again so people can see it. So tell us, LaTanya, what are some of the risk factors?
Before LaTanya speaks, can I say something real quick? I would just ask everyone, have a conversation with the family. grandmothers, mothers, and ask about family history. Because I
Mhm.
told Charlene yesterday, my dad was at the hospital, and I was on the phone telling someone that I was going to be talking about lupus and stroke awareness on Saturday. And my dad turns to me, he said, "You know your aunt so and so has lupus, right?" I
Wow.
said, "No," and she's my godmother. Never knew it, but that's because we don't talk about things.
We don't
So
talk.
I would just say, have a conversation. It's important to know what's in your bloodline.
Mhm. Mhm.
Because
Mhm.
if it doesn't affect you, it could affect your children and your grandchildren.
And I think
So,
her title of her book is so apropos for what Elder Fletcher said. She said that we don't have a way reason how it comes upon us. So yes, it
Mhm.
chooses you. You don't choose it. It chooses you.
right.
And there's
Yeah.
a whole lot of other underlying factors. So yes, Latanya, share with us, what do you think some of the risk factors are, or that you have done some research on?
So some of the risk factors, they can vary among different people. What I've written, as far as for me, risk factors is the sunlight. You have to be very careful. You have to dress from head to toe when being out in the sunlight. Just your natural vitamin D, you have to be very, very careful for. You have to be stress free. And I know that is the most difficult thing people can do, but that's
Mhm.
like has to be number one on radar is how do I live to be happy and love life without stress? You have to eliminate those people that are in your life for doing it. You have to, because your life depends on it. So not only it's your sunlight, it's your stress, it's what you eat. You know, a lot of people are not allowed to actually do exercise because of what state they are in. So it's a slow process. I can tell you 10 years ago, I couldn't go and walk 30 minutes a day. Today I can, but I could barely get out the bed 10 years ago. So you have to do some just very lightweight if it's required you to move your own arm. You know, you have to do some form of manipulating your blood flow, your system, and putting in all the natural nutritions to help it function. I have a multivitamin, whereas that it has everything I need from A to Z, and a few other supplements and things for hair and, you know, for your nails and so forth, so that I can function daily. And I accumulated that by all the medications and supplements I were taking daily. And I figured, hey, why not put this in one? So not only with exercising and eating right and taking your vitamins, other risk factors is not listening to your body. You know, it
Mhm.
took me a long time. It took me to go through a lot of ups and downs to realize that I was not paying attention to my body. You have to pay attention. If you feel a throb right here, there's a reason. If your fingers are swollen and you don't know why, there is
There's a
a
reason.
you
Yeah.
have to pay attention. But for in most cases, there is multiple reasons and risk factors. Eating right, exercise, low stress. I dance. I'll grab my grandkids in a minute and try to do the cha-cha with them here and there, you know, and I'm exhausted within the next two steps. But anything you can do just to enjoy life and drink plenty of water is the key to helping eliminate any risk factors that you come across.
Awesome, awesome,
Okay.
awesome, awesome.
Thank you.
Yes, that's good. So, you mentioned the vitamin D, the sun. So, well, it's just a thought. You know, they're always telling us we need to get the vitamin D in our systems,
Hmm.
and especially African Americans or people who have darker skin tones are usually more vitamin deficient than
Absolutely.
anybody else because we don't go out in the sun that often.
Right.
Right.
So, what happens with a person who has lupus and they um, have a vitamin, they can't go out in the sun. What does that do?
You can take supplements, but you have to get them through your foods. You have to get them through your foods, because if you have SLE, the systematic portion as myself, and I have the butterfly effect, but you guys can't see it on my face because I have a ton of makeup on. But it actually does more damage and leaves lesions. The sun will. It will cause your skin to become very heated. Your skin, people with SLE have a very thin layer. Their medulla is very thin. Their skin layer, the top coat is very thin. So it'll cause more damage than it will good. So what they've recommended is for us to get our food, our vitamin D. We can get it through shots, or we can get it through our nutritional way, which is our foods and fruits and vegetables. You're welcome to take a supplement as well, but those were recommendations for me whom have SLE.
Okay. So Dr. Kim, based on all that LaTanya has shared, and I have the same question we talked about with strokes, what happens emotionally? What's going on emotionally, or what could some of the support be emotionally for someone who is going through an autoimmune, we said lupus, which is the umbrella, or someone who's a family member who's going through this. Yeah. But you know what? Maybe before I talk to you about that, maybe I go back to LaTanya before I ask you this. LaTanya,
Okay.
what was it like? Yeah, let me ask you that
Yeah.
question first. What was it like emotionally once you were diagnosed, because you had a stroke at 19, and then, lupus came behind that. So emotionally.
And lupus, but yeah, emotionally for me, it was a roller coaster. Now, I want to tell you a story. I interviewed a woman who is now 68 years of, and she was diagnosed in the 90s with lupus. And she told me back then, lupus was not to be spoken of. Part of that because lupus was a mental issue. If anyone who was diagnosed with any form of lupus, they was institutionalized. So she said for years, she said nothing of it, because it was a mental, it affected her so deeply. And she said she had issues when it came to going off the hinges, because of her hormones. Everything was just so imbalanced. They were trying to institutionalize her because she had this title called lupus. But for me, it did put me through depression. And I don't want to tell all in the book, but it was a time that I wanted to take my life. It will affect you tremendously, especially when you first start researching. Oh my gosh, back when I found out I have lupus. Well, what is lupus? What is going on? And then when you start searching, all you're hearing is everybody's dying. We don't have a cure. This is worse than cancer. This is worse than this. You freak out. Mentally, you have, you writing your will. You telling your family and friends bye before, it's time to go, because you don't know. So mentally, it will take you stress and take you along a path of, if you don't figure it out, no return.
Can I ask you a question? I remember you saying that you had taken chemo. Was the chemo due to the lupus?
At the time, they didn't know. They were saying it was, and I have to tell the story. I always tell this story. So I was in this machine, and it was a UV ray machine. They have you take these pills in advance to help process with this UV ray machine. And I took it for 2 years, you guys, 2 whole years. And it got to the point where is that they kept saying it was going to help internally and externally, because my butterfly effect was extremely, it really showed. And I was dark skinned, so I had this white, specks of spots all across my cheek and down my nose. And then all of a sudden they started to spread on my back and on my top of my arms. Still today I have them, but the doctors, and I'm not going to say the hospital, the university, just say that they were top notch. And Michael Jackson at one point went there, wanted to, treat me. So they decided to do chemo in this machine. It was seconds. It wasn't that long, but I did it 3 or 4 times a week for 2.5 years. You guys, every single time I came out of that machine, I smelled like burnt fried chicken. Burnt fried chicken. You hear me? And it took one, I just was enough. I came out the machine again. Why do I smell like this? So internally it was doing something, but it wasn't doing what it needed to do to heal me. And I said, enough is enough. So I instantly stopped my own treatments for that and cried and boo-hooed. And, it was also a depression state that I went through, until I was able to figure out another option.
Wow.
Wow. How did your family respond to this?
So that was a good one in my book too. I've been married for over 30 years. So I've had a great support system. In the beginning, it was, she faking it. She's having these pains. She don't want to wash dishes. She faking it. So in the beginning, it was very ignorance. They didn't know until instantly I was going into the hospital and was staying overnight and constantly sick and sick and sick. It was getting worse. It took for my family to see me on my butt to believe what I was saying before, the real deal. And after that, I've had nothing but support, pertaining to it. I have a few family members who, like I said, I'm from the South Side of Chicago, don't believe in doctors. So they think that it's all mental for me, because, nobody gets sick. If it's your time, it's your time. So, but right now my family's very supportive, 110%, in helping and doing what it's taken to make sure that I live a happy life.
Wow.
Okay.
Thank you for sharing that.
Yeah, that's
Sure.
very eye-opening.
Yes. So Dr. Kim, she's our clinical professional here today. And so hearing that, and what would you share with those listeners in terms of the emotional piece that goes along with, wow, going through this?
Again, I would say the diagnosis of whatever the physical or medical condition is not that important to the cognitive piece, because it can be anything. It could be heart attack, stroke, it could be lupus, it could be cancer, give it a name, whatever it is, thyroid disease. That doesn't matter as much as the person actually addressing their mental state at the same time. One of the things that we talk about, especially in chemical dependency, we talk about that for co-occurring, for people who have a mental health disorder as well as a substance use diagnosis, both have to be treated at the same time. So it's the same thing with a physical diagnosis. You also have to have mental health care at the same time, because what it is, it's a co-occurring. It really is. It affects every aspect of your life. It affects your family. It affects you physically. And so it is normal and should be expected that you would have some form of being down, or what we clinically call depression. It would be normal for you to have anger, confusion, myriads of emotions. And some of it is not only psychological, but it's a part of what's going on with you physically. Your brain is being affected with some of these diseases physically, causing, levels of serotonin and dopamine to change in your brain. So you really do need to seek mental health care when you have a physical diagnosis, so that you are being monitored as well as the help is there, whatever type of help that may be. It may just be somebody to listen to what you feel, whereas you can't express it to your family, or they may not understand, as Ms. Tanya was saying. They may not even understand what this diagnosis is. And so you need somebody to talk to help you, maybe to educate them. Right. There's just so many different levels in which having a mental health care person or a therapist or a psychiatrist, and not so much, I really would say a mental health care or a therapist, because psychiatrists just basically prescribe, but having that piece there at the same time, because again, we will often take care of the physical. I got to get on top of this physical thing. I got to go to physical therapy. I got to go to the doctor. I got to take these treatments. I got to do this. But we leave that mental health piece over to the side, not thinking that, yeah, I'm angry. Yeah, I'm but I'm not going to address that right now. They both need to be addressed at the same time. The other thing is, I heard Shunt earlier talking about, she had a young child that was motivation, that type of thing. What I have found, any disease that a person is facing or a diagnosis, more than half, I really would say, of the battle is the positive. You have to have a positive mindset to overcome what you're facing, because your mind is so powerful that if your mind tells you, oh, you have this, you're not going to make it, you're going to die, blah, 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 then that's exactly what it's going to follow. And you can see your health will start to decline. And it has so much to do with that mental health factor. Mm-hmm. Or it could be just the opposite. Your mind says, hey, I'm going to learn everything I can about this. I'm going to be my own self-advocate. I am going to make sure that I'm getting up, I'm exercising, I'm doing what I need to do. Faith without works is dead. I'm going to use spiritual, I'm going to use metaphysical, I'm going to use everything that I can in order to overcome this, because I have a lot of living to do. I'm not through yet. There is a purpose for me here. That's going to take you in a whole different route. So it's so important that a person is able to get there. And at first, when you are hit with a diagnosis, you are paralyzed. Yeah. And you really need somebody to help you to talk through what's going on so that you can get to that place, because you may not be automatically at that place where you can say those things to yourself cognitively. And so as a mental health professional, that is a part of what we do, is a lot of times we help you get to that place where you can say those things and get that positive mindset that you're going to need to overcome what you've been diagnosed with.
You're absolutely right. You nailed it when I tell you nailed it, because that was a part of my treatment, because I thought I was crazy. And so and still today I will see someone, and it's not over so much that I have overcome it. It's just that sometimes I just really need to go and see someone. So absolutely, man. Yes. That was good. Yes.
Yeah. So, I guess I had a question rolling while you were talking, so I should have wrote it down, right? But when we talk about, because a lot of things are rolling through my head, LaTanya said earlier about the emotional piece. Is that a part of the autoimmune disease, to be unstable emotionally? Does it affect your hormones? Is that part of the autoimmune disease? Okay. Okay. Because that's one of the problems I had early on when I first, and I remember that, and I saw somebody as well. I saw a therapist because I couldn't stop crying. That was one of the weirdest things. I don't cry just on the drop of a hat, but I was crying a lot for no reason. I just cried. And I went to talk to her, and the first thing I said, she asked me about my medical history. And I remember telling her what was going on. And she said, honestly, Charlene, I really think this has to do with you having thyroid disease right now. You need to let them get it under control before you really can start. And I remember her saying that, but I agree with you that I think it goes hand. And now that I am a mental health professional, I think that it does go hand in hand. And so that is definitely, and I'm so glad that LaTanya said that, that it was correct, because those who are watching today can know that when they're feeling off and not things are not, and emotionally, not so much physically yet, because a lot of times they're working hand in hand and we need to address them hand in hand. And so you're not going crazy, and you're not, just, you need to seek somebody's professional help and someone to talk to. So I'm glad that Dr. Kim brought that up as well. Chantel, do you have another question?
No, I don't have any more questions. I'm
This is-
just in awe of
This is so good.
yeah, it is. And it's been
It's-
eye-opening.
It
Because I
is.
didn't know anything about lupus before. Well, I knew a little bit, but I didn't know
Yeah, I was sharing with Chantel, I
all
have
this.
a person very, very close to me. I don't want to share her business without her saying it. And since I didn't see her come on today, she did like the post we had, but I wanted her to come on herself because I wanted her to talk about her situation. But she didn't come on. But I do know someone who has it and has had it for a long time, and she's a young person as well. And she's just gone through a lot of physical things, and I didn't know a lot about it except for what I saw happen to her. And,
Mhm.
and it's just a lot of emotional things. It was emotional for me because I watched this person go through it. So I know it was emotional for them as a family, because I'm not in the family, but they're close to me. So hearing your story, LaTanya, it just, it moved me today. It did. And hearing Chantel's story. I
Mhm.
know she had shared some things with me, but I hadn't heard it I hadn't heard the whole story about what happened. So it is very, and I hope others take the time and listen, really listen to this video after it's over, because it has really impacted us and given us a lot of information about health and taking care of ourselves, and just knowing, and also listening to our family members. When they say something is wrong and something's going on, we shouldn't just dismiss it,
Right,
because maybe something is going on.
right.
And maybe she can't wash dishes right now because something's happening, you know. Um, and it's just a myriad of things that could happen that we need to communicate more. Latan, as we are about to wrap it up, unless you have something else to share with us, um, what would you like to tell our audience as well?
So I would like to tell your audience, I am a true advocate when it comes to an autoimmune disease, one being lupus. And I want you guys to know not to give up. I have a foundation called Love Life Lupus Foundation. We encourage, we motivate, we provide resources. We work hand in hand with Johns Hopkins Hospital, the rheumatologist department, so that we can see what else other than the past statistics that we have to work towards getting a cure. And I want to say 60% of what we're going through, and I know that's a big, big number, is mental. If you can control your mental, seek help, you will take another day. You can overcome another day and take it day by day. I say love is life and life is not lupus.
Yes.
Amen.
That's excellent.
Mhm.
Wow. That is so good. I appreciate that. Elder Yolanda Fletcher, what would you say to our audience as we kind of get ready to wrap this up?
Well, first of all, let me thank you all because it has really been a pleasure being a part of this panel discussion. Again, just be an advocate for your health, know your numbers, know your body, but most of all, be able to communicate that. And that's the other part of the coin. I do believe that mental plays a big part of it, and you have to have a positive attitude, expect positive outcomes in all your situations, and you'll get what you're expecting. So if
Right.
you expect a positive outcome, then by all means, whatever it takes for you to get to that goal, your thoughts and your actions will be focused on getting to that goal.
Awesome.
That's
Awesome.
right.
Did we lose Letitia?
Yes, look like we lost her again.
Okay. Dr. Kim, what would you like to say to us and to our audience about the emotional aspect of our conversation for the day?
Again, first of all, thank you, Shirlene and Chantel, for inviting me on. Thank you for utilizing your platform in this way. I would definitely say to the audience, again, if you heard nothing else that I've said today, be sure that if you have been diagnosed with any physical type of diagnosis, please also go seek a mental health professional as well, so that you can be looking at both sides of that at the same time, so that you can have the best results, because we are whole people. We're not just part. We are mind, body, and soul. And so if your body's being affected, you also need to look at what's going on with your soul spiritually and with yourself mentally. So make sure that you are addressing all aspects of your humanity. And just remember, this is Mental Health Awareness Month. So even if you haven't had any type of diagnosis of a physical nature, know that each year, most of us go and have a physical checkup. We go to the doctor and get our little blood work and we do all that. But rarely do we go yearly to have a mental health checkup. So this being Mental Health Awareness Month, just make sure that you are also checking in on your mental health every year.
Yeah, awesome, awesome.
Yes, that was good.
Before we wrap up, I would like LaTanya to please put your book out again for us to see. I really am. It is Lupus. It chose me. LaTanya Baez, PhD. Now, come on, y'all. Hold it up for seconds. I want people to see that.
I took a picture of it and I'm gonna post it.
Are you gonna post it? Awesome, awesome.
Well, let me get a better picture. Hold on a second.
I want people to know her face and the book, and to get, we do better when we know better and we learn better. So I want people to support that. I want people to support her. Do you also have a website, LaTanya?
I do. It is lovelifelupusfoundation.org.
Okay. And Chantel is going to post that along with a copy of your book as well, because we want people to be informed and we want it to help others.
Well, thank you.
So we want to be able
Thank you.
Thank you. Absolutely.
You know, I appreciate you guys letting me on as well, because not only is mental health, it's Lupus Awareness Month also.
Yes.
So
Okay.
yes, hand in hand. So thank you so much for allowing me to be on this platform with you all. I learned a lot as well.
Yes, we have. Chantel, this was Chantel's. She came up with this idea for this month. We
Mhm.
have something every month for what's troubling you, discussions with Chantel and Charlene. And we have discussions each month about various topics. And she came up with stroke and lupus, a discussion. And so I just want to give just a kudos to Chantel because she
Thank
definitely
you.
Holy Spirit when she heard that we needed to do this. So I give it to her because she was definitely in line with this month, and it has moved me. I'm sitting here. I have a lot of thoughts going on in my head right
Mhm.
now. Just and I'm gonna buy the book because
Mhm.
I want to know too more about
Mhm.
the umbrella. So I'm going to purchase the book as well. And so, but I really, really, I appreciate all of you coming. And our final words are going to be from Chantel. And thank you again, Chantel.
I would just say importing, know your body. Also, I had a stroke on both sides of my brain. After my stroke, I got my master's degree. So there is hope. Don't give up. You just have to fight. And I'm not saying it's going to be easy because it wasn't easy. It was hard. It was tiring. I was a single mother and I still had to take care of 3 kids. So you can do it. Just get you a support system. Get you a therapist also. And
Mhm.
it's okay to be upset. It's okay to have those emotions, but don't sit in them too long. So
Mhm.
with that being said, we're out. And I
All
love y'all.
right.
Thank you, ladies.
Thank
Appreciate you
you.
so
Have a
much.
good evening.
All right, you too.
Thank y'all for joining us.
Thank you.